Puetz Jegher syndrome. The first MCQ is Puetz Jegher syndrome is characterized by option A deafness, option B scleroderma, option C multiple intestinal polyps, option D multiple supernumerary teeth. So Puetz Jegher syndrome is characterized by which of the following? So Puetz Jegher syndrome, it is a hereditary intestinal polyposis syndrome. Hereditary intestinal polyposis syndrome, and it is a rare familial disease. So it is an autosomal dominant disorder featuring gastrointestinal polyp and the pigmented macule on the lip and the skin. So it has two features. One is gastrointestinal polyps and pigmented macule on the lips and skin. So let's see some etiology. It has germline mutations. The gene included in this condition is LKB1 gene on chromosome 19PL3. So let's see some clinical features. So in age, it mostly occurs in the childhood and no sex predilection. Intestinal polyps, the major manifestation of Puetz Jegher syndrome is the intestinal polyps. So it is found in anywhere in the gastrointestinal tract, but most frequently in the small bowel, especially in the jejunum. So and the number and rate of growth of these polyps are variable. So it is a multiple intestinal polyps. And symptoms, the symptomatic, it becomes first it is asymptomatic and then becomes symptomatic, and it produces ulceration with bleeding and anemic from chronic blood loss. So the polyps are usually benign, but malignant transformation may also occur. So Puetz Jegher syndrome has been accepted as a precancerous syndrome. So it is a precancerous syndrome. In 50% of the patients, it transformed into malignant transformation. And tuberous sclerosis, the tuberous sclerosis is a frequent neurologic problem in Puetz Jegher's patients, and it is characterized by, it has three conditions: hematomatous polyp, mental retardation, epilepsy, and adenoma sebacum. So in pigmentation, it also characterized by multifocal macular melanin pigmentation in perioral location, and it manifests itself as a freckle-like macules, and it present on the hands and perioral skin. Especially intraorally, it includes the gingiva and buccal and labial mucosa. So site of the oral pigmentation included are, most commonly it occurs in the lower lip and buccal mucosa, but rarely on upper lip, tongue, palate and gingiva. The color of pigmentation, bluish black macules on the skin, and orally it present as a brownish macules. And clinical significance, only diagnostic clue to more serious intestinal problem. Any child with recurrent unexplained abdominal pain should be examined for the cutaneous and mucosal pigmentation of PJS. So here, child having unexplained abdominal pain and cutaneous and mucosal pigmentation. So management is, no treatment is required for oral lesions. Referral to gastroenterologist is recommended. So the answer is option C.